often have a habit of saying take care every time I meet someone, and I really mean it when I say it. So today I'm going to discuss a subject that not just concerns a lot of women, but a subject where they really need to take care of themselves. Fibroids, a medical condition that affects about 30% women by the age of 35. In fact, another research suggests that about 80% women develop fibroids by the age of 80. And today, helping me understand the severity and the ways to manage fibroids is Dr. Sejal Surti from Aster Clinics and Hospitals. Doctor, very important topic today, and I think most women face this issue, and that's fibroid. What are fibroids all about?
So basically, uterine fibroids are the most common benign tumor which is seen in women, affecting almost about 70% of women by the time they reach the age of 50. And they are arising from the uterine smooth muscle, which is in common language the womb of the lady. And the wall of the womb of the lady.
What are the symptoms? How do we know that we have fibroids?
Any lady who has this fibroid can present with a variety of clinical challenges. And the most common symptom is that of abnormal uterine bleeding in the form of heavy cycles, bleeding which lasts for a longer time, which is with passage of clots as well. The other symptom that the lady can have is because of the bulk of the fibroid itself, because it occupies a large portion of the uterus, compressing the other organs which are besides it, like the intestines and the bladder as well, giving rise to symptoms of constipation and frequency of urination as well. And the other symptom is that of having reproductive dysfunction, in the form of either having difficulty to get pregnant, or if she's already pregnant, to carry on the pregnancy till term.
So doctor, how do you decide on managing patients with fibroid?
So basically the treatment of the fibroid needs to be individualized according to the patient's symptom, her age, the size and the location of the fibroid, and the need and desire for the lady to have future pregnancies and conserve her uterus or no. So all these factors will decide what modality of treatment we are going to give to the lady who is suffering with fibroid symptoms.
So what are the different kinds of treatments, doctor?
The various treatment options for a lady who is having fibroids are medical treatment, surgical treatment, and conservative minimal invasive therapies. There's also a mode of expectantly waiting and watching for women who are not symptomatic to see whether they are growing in size by doing an annual checkup for these ladies.
Right.
There are chances that the lady will have the smaller ones which will grow up later on. Yeah.
What about women who are pregnant and have fibroids?
It depends on what exactly the size of the fibroid is when she gets pregnant. So any lady who is pregnant with fibroid, there are a few things which we will be taking care of extra. In the sense, she may have a chance of the fibroid being big in size and disturbing the uterus wall, causing some contractions prematurely, giving rise to her chance of having premature labor. Then as she advances in pregnancy, if the fibroid is in a location where the placenta is, there are chances of having dysfunction bleeding from that area as well. When she goes into labor, because of the position of the fibroid, there are chances of having dysfunctional labor as well. So any lady who is pregnant with fibroid, there are a few things which we would be looking more carefully into.
And then decide what she
needs to do.
Any lifestyle changes that we can make to avoid having these fibroids?
Basically, fibroid is within the uterine smooth muscle, and the growth is said to be influenced by the female hormones,
right,
the estrogen and progesterone. So our lifestyle and our diet, which helps to regularize the female hormones, would definitely reduce our chances of getting it.
Correct.
And even if they are there, to reduce the chances of them growing larger in size.
And faster. So basically, a disciplined lifestyle and focus on nutrition and fitness definitely can help us avoid fibroids.
Definitely.
Right? Doctor, that was really informative. I'm sure all the women watching this found it very helpful. because it's a very common issue, as you said. And thank you for coming on the show.
Thank you so much for inviting me, Uma.